In this video, I'll be talking about patients presenting with deafness, vertigo, and tinnitus. Please note that this is not looking at individual symptoms, but rather it is discussing how to differentiate the clinical picture of the patients presenting with these three symptoms. Also, a more in-depth discussion of the diseases can be found in the links at the end of this video and in the description below. Right. So the exam question could be a patient presents with all three of these symptoms, or one of them, and you find the other two on history. What are the causes? Meniere's, acoustic neuroma, also known as vestibular schwannoma, or autosclerosis. Now how to differentiate? Let's see. If the deafness is mainly low-frequency sensorineural hearing loss, i.e. they hear high-pitched sounds better, they only experience vertigo for minutes to an hour, they have unilateral tinnitus, and they have a feeling of fullness in the ear, this is Meniere's disease. The acute management is buccal iron chlorperazine, but be careful of the contraindications. These are Parkinson's, pheochromocytoma, and a CNS depression or comatose patient. And in this case, an alternative drug of cyclizine can be given. This is Meniere's disease. Next. If the deafness is a high-frequency sensorineural hearing loss, i.e. they hear low-frequency sounds better, the vertigo is constantly there, they have unilateral tinnitus, and on top of this, on examination you find cranial nerve signs, so facial nerve compromise, which results in facial weakness, or trigeminal nerve compromise, which is seen as loss of corneal reflex, then this is acoustic neuroma. This diagnosis is confirmed on MRI of the brain and the internal auditory meatus. The management is to firstly ensure the patient is stable, then refer them to ENT. ENT will observe this patient and determine if they need radiation therapy or surgery to remove the neuroma. Finally, if the patient presents with deafness caused by what you think is due to conductive hearing loss, they have bilateral tinnitus, they're a young patient or a female who has recently fallen pregnant, they have a positive family history of the same problem, then this is autosclerosis. You need to investigate it further by otoscope, where you'll find a positive Schwartz sign. This means you'll see a reddish plush spot, also known as flamingo flush, on a mobile tympanic membrane. You manage this with surgery to do a stapedectomy or a stapedoctomy, and you can also use hearing aids. And this is autosclerosis. So to recap, low frequency sensorineural hearing loss, vertigo, a feeling of fullness in the ear, that's Meniere's. High frequency sensorineural hearing loss with cranial nerve signs, that's acoustic neuroma. And conductive hearing loss in a young or pregnant, then that's autosclerosis. If you'd like more information on the symptoms or the diseases, then click on the links in the video or down below. I hope you enjoyed this video. If you did, then click the like button or comment below. And for more, subscribe to the channel.